Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for British Columbia for Thursday, May the 13th, 2021. Tomorrow, Friday, we'll be providing a written briefing at around 3 o'clock with relevant information about the COVID-19 pandemic in Britain. As we are in Victoria, in the Legislative Assembly, to be on the territory of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations, and we're honored to be here on their lands. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you very much and good afternoon. And I want to start by recognizing that this is the day that starts the end of Ramadan. It's the day about love and peace. And I wish all of my friends and colleagues who celebrate this who celebrate this day an Eid Mubarak. And I know this is the most challenging time both here in BC and around the world. And let's hope we can leave behind these challenging times for next year's celebrations. So today we have 587 new cases of COVID-19 to announce here in British Columbia, including one epidemiologically linked case, to bring our total numbers of people diagnosed with COVID-19 to 137,810. That includes 126 people in the Vancouver Coastal Health Region, 365 in the Fraser Health Region, 21 people who are in the Vancouver Island Health Region, 60 people in the Interior Health Region, and 15 people in Northern Health. We currently have 5,691 active cases across the province, of whom 413 people are in hospital, 141 remain in critical care or ICU. And 130,310 people have recovered from the acute phase of COVID-19. As some people may have noticed, we are no longer reporting on the number of people under active public health monitoring or follow-up, and this is for very practical reasons. This was a metric. It was basically to give people a sense of how many people have been required to be isolated or in quarantine because they've been exposed to somebody with COVID-19. And we initially started this last summer when we had our surge of cases in the interior around Kelowna as a way of helping people understand the impact that it was having, not just on people who were diagnosed with COVID-19, but on their contacts as well. This information, however, is based on public health follow-up with every single contact, and that continues. We do case management and contact tracing across the province, and all contacts are followed up on an individual level, but pulling that data together to be able to report on an aggregate level has become more and more challenging. We don't have an IT system that does that automatically, so my colleagues in the health authorities tell me it is very time-consuming and difficult to verify. So rather than provide information that is no longer accurate, particularly as cases had increased over the last little while, and it is something that doesn't affect our day-to-day work in public health. So we've made the decision to stop posting that information because it no longer was accurate enough for that. We have no new outbreaks to report today, which leaves us with 3 outbreaks in active outbreaks in long-term care assisted living or independent living, and 2 in acute care. We have 5 additional deaths in the province today, bringing the total number of people who've died from COVID-19 to 1,632. Most of the people affected, again, were over the age of 70, several in their 80s and 90s, and 1 was a person in their 60s. And our condolences go to all of the families who are mourning the loss of their loved ones, their community, and their care providers. We know how challenging it is in this time. I also want to report today that we have had a second case of vaccine-induced immune thrombotic thrombocytopenia, or as we call it now, VIT, following receipt of the AstraZeneca vaccine here in British Columbia. This person is a male in their 40s who is in stable condition now, receiving care and treatment in the Fraser Health Region. As we know, this is a rare but very serious condition, and we are following it carefully. Recognizing the symptoms and getting treatment early is important. This is a condition that's we're learning more and more about since the safety signal was first detected. And what we do know, it is caused by, for some reason, in some people, the vaccine seems to stimulate an immune response that develops antibodies against our platelets. So this causes a type of clotting that is different from other types of blood clots that people may have had, or strokes or other types of clotting disorders that people may have. So it is a very challenging one to treat, but there is a test for it and there is treatment. So people, if anybody after any vaccine in the last 4 to 28 days and is feeling unwell, you should call 811 or connect with your healthcare provider, particularly if you have serious symptoms which include persistent severe headache, shortness of breath, ongoing chest pain or abdominal pain, swelling or redness in a limb. Those are things that should cause you to seek treatment right away, and there is a test that can be done that helps us indicate whether this is the cause of those types of symptoms, those types of clotting symptoms, and that's a basic test of platelets. That is one of the first ones that needs to be done. We are following this carefully, and as we know, it is rare, but it is also serious. And we need to look at it in the context as well of the serious illness that we continue to see, particularly in people in their 40s, 50s, and 60s with COVID-19. On that note, so far in British Columbia, we have delivered 2,335,513 doses of all 3 of the COVID-19 vaccines here in BC. Of these, 119,691 have been second doses. So this means that over half, 50% of those who are eligible, so adults over the age of 18 here in BC, have now received their first dose of vaccine. Our immunization program is moving quickly as more and more vaccines are available, and the ages for those are eligible are coming down. We anticipate that all adults will be eligible very soon. We are also actively working to incorporate the age 12 to 17 into our immunization program, and we will be sharing more information about that early next week. And I know how important this is, particularly to that group of teenagers in the 16, 17, 18 who are finishing high school this year, and we look forward to this being another thing that will be important to ensure we can have some safe celebrations of graduation coming up in June. And so stay tuned as well. We will have more information about how we can support graduations for young people this year, knowing how important that is. I will say yesterday as well, we communicated that we have made that decision to reserve all of our remaining AstraZeneca vaccine for second dose boosters for those who want it. This is not about vaccine safety. That is, of course, an important consideration, but really it's about the operational response and the position we are in BC right now, and also in the context of the global supply. Operationally, we now have an abundance of Pfizer and Moderna vaccines and are expecting more to come in the coming months. So that time to wait, as we had before, has been reduced, and soon all adults will be eligible for vaccines through that program. The AstraZeneca vaccine has been an important and key part of our program, particularly when we had paucity of vaccines over the last few months. And I do want to say that it is important for people that received AstraZeneca. You did make the right choice, both to protect yourself at a time where the risk of COVID has been very high and continues to be high, but also in receiving that vaccine, and any vaccine, you also protect others and make sure that we can get more people protected quickly in our system. Operationally, though, it means that other nations around the world also have challenges in getting vaccine, and we're seeing what's happening in countries like India. So it is incumbent on us in Canada to make sure that we're not taking more than we need. And with the supply that we have in place coming for Moderna and Pfizer, we don't need to have additional supplies of AstraZeneca at this point. We will continue to ensure we have sufficient supply for dose 2 for everybody who's received dose 1 with AstraZeneca, and we'll continue to follow the data on the studies around the world that determine, that will help us understand which is the best option for people for dose 2 if they received AstraZeneca first. And in that way, we'll let you know. It's my expectation that people who have received AstraZeneca so far will have a choice once we know more about taking Pfizer or Moderna as a second dose. So now I'd like to spend a little bit of time going through some of the data that we have around how well vaccine is protecting people in British Columbia. I've had many, many questions about people who have received at least one dose and whether they've become ill afterwards and what that means and who's been affected. So I have a few illustrative slides here to help summarize what we've seen here in British Columbia. So what we call a breakthrough case is somebody who has received at least one dose of vaccine, and initially we look at a period of time, 7 days, 14 days, 21 days. It takes some time for your body's immune system to respond to the vaccine and develop those protective levels of both antibodies and the cells in your body that help protect you long term. So what we have seen since December 27th, when first doses were initiated, until the 1st of May, is that we've had about 79,480 cases of COVID-19, and the vast majority of them have been in unvaccinated people or people who have not yet mounted that full immune response. Those who have been vaccinated and at least 3 weeks after their dose 1, we've had 1,340 people who have been affected. That's about 1.7% of the cases. And there's about 120 people who have had 2 doses and have been infected with COVID-19. Of the 1,340, 141 people were hospitalized. 13 people ended up in ICU, needing ICU care, and we have had 30 deaths. Like what we see with our cases overall, the average age of cases reflects what happens in the community, so where we've been seeing transmission, and the median age is about age 49. The age of people hospitalized goes up, as we know it does for across the board. And the average age of people who've been immunized, who've required hospitalization, is 81. The average age of those in ICU is 71, and the average age of those who've died, sadly, is 87. So that reflects again that the main risk continues to be age in having severe disease and hospitalization. This is a graphic that shows you where we see most of the cases after people have been immunized. And on the top is people after they've received first dose. We can see that it does take, there is a drop-off after 14 days and then an additional drop-off after about 3 weeks, day 21. So this is when your body is developing the immune protection that you need to protect you long-term. We can see, though, that it rapidly tapers off after that, and after several weeks, we have very low rates of infection. The bottom is case counts, because we've had such low numbers of people after 7 days after receiving their second dose of vaccine. We see that there's just sporadic cases, and again, those drop off after time. I will say that this reflects primarily the Pfizer vaccine, because that has been the majority of people who've received vaccination has been with Pfizer. So 1,110 of the cases received Pfizer, 127 Moderna vaccine, and 103 AstraZeneca or the Covishield vaccine. We have some great similar data that comes from the First Nations Health Authority, who, as we know, have been following the COVID outbreaks and vaccination in First Nations communities, and this reflects very similar to what we've seen overall. This uses 14 days post first dose. So again, we see a dramatic drop off after 2 weeks, and again a second drop off after between weeks 3 and 4. And these were 353 cases in First Nations communities. You'll remember that First Nations communities were prioritized for a variety of reasons to receive immunization, and for most of the communities, we've done it in what we call a whole of community approach. And this is a nice representation as well of the reduced risk of infection after a single dose of vaccine. So this is important. It is the number of total cases per 10,000 people, and with the orange lines show you the rate prior to immunization, and then the blue lines are post a single dose of either AstraZeneca or Pfizer or Moderna vaccine. So again, really positive, showing us the risk decreases dramatically, but it is not zero, and it takes some time to get to that level of protection. Some of the other data that we've been following is looking at some of the communities where we saw very high case rates, and we went in and immunized the community as a whole. And this is the information from Prince Rupert, and when the gray bar shows the time period where the immunization clinics were happening, and then the drop off over time. And the important thing here is, even though cases were increasing in the community at the end of March and through April into May, outside of Prince Rupert, we saw a sustained and low level in Prince Rupert itself. So this is something that helps us understand what may happen as an entire province once we get to those levels of immunization. The fact that we can see rapid drop-off and sustained drop-off over time when we have that community immunity, even in an area like Prince Rupert. The other places where we've seen this similar phenomenon has been following the data of long-term care, where healthcare workers working in long-term care who were prioritized to receive vaccine first. We had a dramatic drop-off over time, and that was sustained even through this third wave, where we see the blue line on the top is healthcare workers in settings other than long-term care, where we did see higher levels and a bump up during the third wave. And we see the same thing as well for residents. So residents in long-term care homes, 70 and above, on the bottom line, once we reach that point where 90% of residents in long-term care or assisted living had been immunized, we see a rapid and sustained drop-off of transmission. And we look at these as small microcosms or communities within themselves where we've reached that point of community or herd immunity within that care home. And despite the dramatic increase that we've seen over the last few months in cases in the community, in the same people aged 70 or over, we see this sustained decrease in protection in our long-term care homes. And if we look at it again, this is taking just that portion of 70 and above, and on the bottom you can see the immunizations in that age group have gone up. On the top it shows hospitalizations, and it tells us again that once we protect people with immunization, gradually we see a decline in hospitalizations, and now we're starting to see the effects in those age 40 to 60. So data I've presented in April showed that it was the 40 to 59-year-old age group that was increasing in our hospitalizations and having more severe infections. Now that immunizations have increased in that age group, we're starting to see that level off as well. So what does this tell us? This tells us that we're seeing really strong progress through our immunization program across the province, and it's making a difference at a health authority or at a healthcare facility level, at a community level, at a population level. But we need to keep it up. And there have definitely been infections, We know that this vaccine, even after 2 doses, all of the vaccines we have are not 100% effective, but they do absolutely reduce your risk of infection, and importantly, they reduce your risk of transmitting to others, and they reduce your risk of being in hospital, of needing ICU care, or of dying. So these are important things for all of us. One thing I will say is we've started our program based on risk, and that's your own personal risk of having severe illness or death. That's why we started with long-term care homes, why we started with our elderly and seniors first. So we expect to see when more and more people in our community are across the board are immunized and protected and case rates start to fall, that we will see a rapid drop-off in transmission across the province. So just a final note, we are doing what we call vaccine effectiveness studies, so the detailed studies comparing individuals who are immunized and non-immunized, and the team at the BC CDC, led by Dr. Skavronsky, is pulling that data together. We've now past that period of time for older seniors where we can understand the impact at a community level, and we're working down the age groups as 3 weeks have passed since we reached the threshold in people aged 60 to 70, for example. So more of that information will become available to us in the next few weeks, and we will share it when it's available. And these slides will be posted on the BC CDC website, so you can go back and look at them at will. So what does this tell us? It tells us that our risk-based approach to the immunization program that we've had here in BC is working, and it shows us a glimpse of where we as a province will end up in the coming weeks and months. We've seen very big benefits from our immunizations in the highest risk people in our communities, and the effectiveness of vaccination in a whole of community approach. It's a good indicator of where we will be in our province-wide approach. Receiving the first dose of vaccine substantially reduces infection rates and reduces your own personal risk. However, 1 dose doesn't give you or those around you complete protection, especially when, as we continue to have high rates of circulation of the virus in our communities. That's why a 2nd dose for everyone is also incredibly important. So the 1 dose shows COVID-19, and a 2nd dose pushes it back. Even though lots of people are now vaccinated, there's still a lot of virus circulating. We won't get to the bottom of our infection curve until we get to a much higher immunization rate. So everyone needs right now to register to get vaccinated, and we know that it will be all adults very soon, will be your turn. It's also, though, why it is incredibly important for us to continue to take those measures that break the chains of transmission in our families, in our communities, in our workplaces. Immunizations are going up, and community transmission is trending down. Those are the things that we need to continue. What we are doing in BC is working. As more and more of our loved ones in our communities and our families are being protected, and we're taking those measures to reduce the transmission. So let's keep that curve bending down. We look to brighter days ahead, but right now we need to hold the line. We need to keep doing what we're doing as we get more and more people protected. So we will not be seeing any changes to the measures that we have in place right now until after the May long weekend. And even then, it's not going to be flicking the switch. It's going to be gradually and slowly increasing the light. And that is important for all of us. We can see a future where we don't have to have COVID-19 ruling our lives, when we can get back to doing the things that we know are so important for us as individuals, as families, and communities. So let's keep this momentum going, and remember to continue to be kind, to be calm, and to be safe. Thank you.
Thank you, Dr. Henry. I wanted to start on behalf of the Premier of the government, I think of everyone in BC, to pass on my condolences to those who lost their lives in the last 24 hours, and indeed throughout the pandemic. 1,632 people since the beginning of the pandemic have lost their lives linked to COVID-19, to families, to caregivers, to communities, to friends. These are enormous losses, and we continue because we are limited in the ways we can come together to grieve, limited in that way. And so we all need to, all of us as communities, grieve together and support those families who've lost loved ones in the course of this pandemic. I wanted to note that we have we did 8,195 immunizations yesterday, which is a significant achievement for all of our immunization teams and all the different health professionals and healthcare workers and people who are supporting our immunization efforts across BC. These are remarkable achievements that everyone involved in them, from doctors to nurses to pharmacists to all those who are working to support, to firefighters, to other emergency first responders, to ambulance paramedics, to all those who are involved in our effort. We say a big thank you for yesterday and for all of the other days. I'd note that in terms of vaccination by age groups, these are a day old, but over 70, 86% have received their first dose. Over 60, obviously that includes the people over 70, 81%. Over 50, that's 74%. And over 40, it's 66% of people. And so we are making progress, and we have a significant way to go. Part of the thing that we all need to do, and the three words for today are register, register, register. 2,596,062 people have now registered since April 6th on our Get Vaccinated website, or by calling into our number. So that's a significant number. And yesterday, the top groups, age groups by registration were 18 to 24, 30 to 34, 25 to 29, 35 to 39, and 40 to 44, and that is good. Everyone needs to know we opened up yesterday and sent invitations to book to all those over 30, people born in 1991 or earlier. It's over 18 or born in 2003 or earlier if you were in a hotspot. Indigenous people born 2003 or earlier will be invited to book almost as soon as they register. Clinically extremely vulnerable people as well, and pregnant people born in 2005 or earlier. And just as Dr. Henry has said, and this information has gone out from Immunization BC, on May 14th, which is tomorrow, those born in 1996 or earlier who are 25 and above will be invited to register. That's after 7 o'clock, and overnight those invitations will go out. So if you're in that category, it's a significant category, then you will be eligible then. On Saturday evening, after 7 o'clock, those born in 2001 or earlier, 20 plus, will be invited to book. And the key to booking is to have registered. And on May 16th, Sunday, those born in 2003 or earlier, all across the province, 18 and above, will be invited to book their appointments. The key is to register. So if you know anyone, especially those between 18 and 30 who haven't registered yet, or thought the age-based immunizations was a sufficient way away from them, now is the time to register, register, register. It is a big, I think, a big move in terms of the age cohorts. Is going to happen over the coming weekend. And so now is the time. And if there's any doubt about the value of immunization, I think Dr. Henry has taken you through that today. It is transformative, of course, to people and their safety from COVID-19. I want to report briefly on our surgical renewal commitment. You will know that until the COVID pressure on our hospitals reduced, we are reducing in select hospitals in the Metro Vancouver area, in the Fraser Health and Vancouver Coastal Health Authority. We are postponing non-urgent elective surgeries. To date, the number of surgeries postponed from May 3rd to May 9th was 664. That's 305 in Fraser Health, 314 in Vancouver Coastal Health, and for other reasons, 45 in Vancouver Island Health. Once again, it remains the case that in Interior Health, Northern Health, and the Provincial Health Services Authority, no surgeries were postponed. So in total, from April 19th to May 9th, a total of 1,483 surgeries have now been postponed. in the week April 26th to May 2nd, and health authorities completed 6,664 surgeries, of which 5,274 were scheduled and 1,390 were unscheduled. These numbers reflect, and it shows the enormous work still being done for people across health authorities, but they reflect what we expected to see. It doesn't lessen the disappointment the postponements caused our patients, their families, and their care providers. Again, each of those patients will be contacted to rebook their surgery once the pressure on our hospital decreases. I note in that regard that in terms of base beds, we have about 638 vacant base beds across our system and 3,076 vacant surge and base beds, and in ICU, 76 vacant base beds and 273 vacant base and surge ICU beds or critical care beds. However, we are using surge beds in the Fraser Health Authority and the Vancouver Coastal Health Authority, currently 175 surge beds and 21 critical care beds are being used. And what that says to us is that COVID-19 is still circulating too much in our community. Hospitalizations have come down from the peak in April by about 98, so we're at 413 today in hospitalizations, but that is still way too high. 141 in critical care, still way too high. And the greatest gesture each of us can make in respect of those awaiting surgery, for example, is to get vaccinated. If we have not registered, again, we must register now. And when we're invited to book our shot, we must book right away. We can go to the Get Vaccinated website again, or alternatively, 1-833-838-2323. That's 1-833-838-2323 to take that vital step in making ourselves and our communities safe. Right now, 51.5% of those eligible have had their first shot, and 2.8% have received their second dose. And while many of the key indicators show that the COVID-19 pandemic is moving in the right direction, let's face it, 500 to 600 cases a day is still way too high. We need to continue to use our COVID skills, register, and get our vaccinations, and remembering all those who count on us to stop the spread. It will make all of the difference. And that difference will be shown in the days and the weeks to come. Aujourd'hui, nous annonçons 587 nouveaux cas qui ont testé positifs pour COVID-19, pour un total de 137 cas en Colombie-Britannique. Nous sommes attristés d'annoncer 5 nouveaux décès liés au COVID-19 pour un total de 1632 décès en Colombie-Britannique. Nous offrons nos condoléances à tous ceux qui ont perdu leurs proches durant cette pandémie. Parmi l'ensemble des cas confirmés de COVID-19, 413 personnes sont actuellement hospitalisées, dont 141 en soins intensifs. Merci beaucoup. Thank you very much. We're happy to take your questions.
A reminder to reporters on the line, please press *1 to enter the queue. You are limited to one question and one follow-up. First question, Shannon Patterson, CTV.
Oh, hi, Dr. Henry. You probably saw that the CDC in the United States today issued new mask guidelines saying that Americans who are fully vaccinated can now take their masks off, both inside and outside, for any size gathering. Obviously, they have more fully vaccinated people than we do here in BC, but when can we expect guidance like that here in British Columbia about mask wearing inside and outside? What percentage of vaccinated adults do you want to see before we're going to be getting some sense of when we're going to have guidance like that?
Sure. So there's a couple of things about that. So we are not using only immunized percentage, although that's obviously an important piece, both first dose and second dose. We're also looking at the trends in transmission in our communities. And I know we spend a lot of time thinking about the day-to-day numbers, but really it's how do we look at the numbers over time, what's happening in our communities. So those are going to be some of the factors that we are putting into the Restart 2.0 that we're working with across government and the public health input into that. And it will have advice and direction and guidance on several different aspects, on things that we can do in our communities once we reach a certain level of protection through immunization, as well as seeing trends in the right direction for the other important factors, but also the individual level things that we can do. So expect to start seeing some of that after the May long weekend in more detail. And of course, I'm working with my colleagues across the country to make sure that we're all aligned in some of the messages that we're giving.
Shannon, do you have a follow-up?
Can you specifically let people know if they're outside? We had our top infectious disease expert, Dr. Sharkawi, say that if you've had one dose of vaccine, the chances of you contracting or spreading COVID outside is basically zero. So can people who are outside, assuming they're not in a great big giant jammed up crowd, take their mask off? What's your advice for outdoor mask wearing?
So we have always said that when you're outside, as long as you're as you say, not in a large group together, talking closely with people, that masks are optional. And we know that outside versus inside is much, much less risk. If there's any breeze at all, things disperse rapidly. So if somebody's walking by you or running by you on the sidewalk, even if they come right close to you, the chances of spreading COVID that way are zero. As close to zero as we can possibly get. So I think we need to be rational about wearing masks outside. I know many people like myself, if I'm going between shops where I'm going to be putting it on and off, then it's just as easy to wear it. And particularly if we're in a crowded area or a crowded sidewalk, then it's just as easy to wear it as not. But I agree with him. I think the risks outside are so much less than inside. And, you know, it's important to be able to get outside every day, and I encourage everybody to do that, especially now as we're able to do that more and more. Being outside is a safe way of being with people, keeping our distance, and especially after we've been immunized, we know that the risk goes down even more.
Next question, Richard Zussman, Global News.
Dr. Henry, there's been a story just published in the South China Morning Post around BC's long-term care system. And the investigation found that more than 1,000 people at 42 homes where outbreak status was deliberately not declared when a low-risk staff fell ill. I don't know how much information you have on these sort of cases, but how concerned should people be that there wasn't a declaration of an outbreak in long-term care homes where there were sick staff?
Yeah, so I think we've learned a lot as we went through this pandemic, and we have outbreak management protocols that we put in place very early on. Initially, they were based on what we did for influenza, which usually has at least one sick resident or transmission within a facility, and then we recognized that that was not sensitive enough. It didn't catch outbreaks early enough with this new virus, COVID. So it was the public health teams looked at where we were seeing transmission, and you remember early on how rapidly it would spread within facilities. So we do declare an outbreak with a single staff with exposure within the facility or a single resident in the facility, and that was across the board. Where we had some clinical judgment was if there was a single staff person who had not been in the facility during the period of time of their infectiousness, or had been fully adherent with the infection control precautions like wearing of PPE. And then there was a judgment made about the risk, and that was an enhanced surveillance where we did some extra monitoring and testing, and then if testing showed that anybody else was positive, then an outbreak was declared. So it was a way of making sure that we weren't overly cautious and putting in place those very severe measures that an outbreak entailed. And we know how hard it was on seniors and elders in long-term care. There were many, many cases where there were low-risk healthcare worker exposures. They may have become exposed in the community, been sick, but not been in a risky environment within the facility during the period of time they were infectious. And so most of those did not result in an outbreak, but those are the guidance that public health was following and was very meticulous about over the fall and winter.
Richard, do you have a follow-up? Richard?
Sorry about that. You mentioned, back to the CDC report, Dr. Henry, you mentioned this Restart 2.0 that will come after the May long weekend. What sort of information should people expect to get around how this is going to work, how it's safe to unwrap ourselves, and what sort of communication plan will be part of that?
So there will be a communications plan. I think what people need to know is nothing is changing right now. We are in a place where we're in a good direction, and we need to keep it up. And we need to keep it up at least through the end of the May long weekend. So don't start thinking about making plans now until after that period of time. And then we'll be going back to the same approach that we took last May, where we started gradually increasing our activities based on risk, based on monitoring what is going on, how many more people are being immunized, how our case and transmission rates were going down. And that will continue through into the summer. I think we can start, if things continue to go in the right direction, then by the time we get to our July long weekend, we should be able to do even more in terms of having small gatherings, in terms of having those events that are so important. And we think back to last summer, how we were able to do that successfully and safely. So people planning weddings and things like that, we still will have the need to be cautious, and through a period of time, make sure that we are keeping the virus down. And then as we move into the fall, if things continue to go the way we expect, and I put these caveats in because we learn all the time. This virus has taught us that we cannot be complacent. We know, I'm watching very carefully what's happening in the UK, and I think that's a very good example for people to think about. Slowly, gradually reopening, getting back to doing the things that we need to do in our lives, and not getting through the pandemic part, learning how we can safely live with COVID and be able to detect clusters and outbreaks quickly, get back to the public health work that keeps these things controlled, like we do with every other reportable communicable disease, things like influenza, things like measles. So that's the goal, but it's going to be slow and gradual. We have learned that from watching around the world, that if we move too quickly, the virus can take hold again, even when we have immunization to protect us.
Next question, Glenn Korstrom, BIV.
Hi, I couldn't quite see the charts as I phoned in, the ones that you showed earlier, but it sounded like you said that there were 13 deaths in people who have been vaccinated. And I was going to ask about, there's 55 people who died in the past couple of weeks, and you didn't break down in the briefings whether they had been vaccinated or not. So I'm wondering if you could do that going forward, and how many of those were vaccinated with one dose or two.
And the short answer is no, I can't do that. We're talking about two completely different systems. So on a day-to-day basis, at my level, at the provincial level, I don't actually know the individual and whether they're immunized. For the most part, I do know it from some of the long-term care outbreaks, for example, because the public health team on the ground is able to understand, does the investigation on the ground. So that person's individual clinician and knows whether they've been immunized or not. But that data that we use to look at it at a provincial level is linked data that we get after the fact. So I can't tell you of the 5 deaths that happened today, whether each individual person was immunized or not. The public health team knows that on the ground, their clinicians know that, but it takes time for that to catch up. So what we can tell you is on a population level, how many cases there have been, and the analysis that I shared, it's over the period of time from December 27th until May 1st. So it would be all of the deaths that occurred between that period of time.
Glenn, do you have a follow-up?
Oh, okay, so just for clarity on that, you are saying that it's accurate there are 13 deaths in people who have been vaccinated. And then as a follow-up, a lingering question I've had is on recoveries, because months ago you were saying that people would get 2 negative tests to determine that they're recovered, but I've heard of people who are just considered to have recovered after 2 weeks of self-isolating. So So first of all, just clarify, 13 deaths, is that the accurate number? And then
No, that's not correct, actually. It was 30 people who died between December 27th and May 1st, 26 of whom had received 1 dose of vaccine and 4 had received 2 doses of vaccine. And I don't have the total number of people who died in that period at my fingertips, but we can certainly get you that information. In terms of recovery, so yes, early on in the pandemic, we used testing, but people needed to have 2 negative PCR tests to be declared recovered. But it became clear very quickly that, and this is where science in action, the studies around the world helped us to understand that you can actually shed virus through your secretions and also through stool in your bowels for quite a long time. And for some people that can be weeks or months, but it's not live virus. So you're no longer infectious to others. And so data that originally started with a study out of Germany showed us that following people and detecting live virus, that it fell off very rapidly after about 5 or 6 days, and that at most it was about 8 days that people were infectious to others after their symptoms started. And so we've used now 10 days, and this is in use mostly around the world. So after somebody's infectious, their symptoms have started, if they're getting better, and they're, and I say not 100% better because some people have persistent cough for a while, but for the most part, if you're infected, you're at home, after 10 days, you're no longer infectious to others. So that's the end of the isolation period for somebody who has mild disease. It can be quite a bit longer for people with more serious illness, or so if they end up in hospital, it may be longer than that, depending on the course of their illness, or people who have immune suppression who may actually be infectious for longer. So on an individual basis, they may be asked to isolate for a longer period of time. So that's the infectious period from somebody who's infected with the virus. And so we consider somebody recovered from the acute illness once they're past their infectious period. In terms of people who've been exposed, we know the incubation period. So the time from when I've been exposed to the virus to when I can develop symptoms remains about 14 days. So that's why we require close contacts of people or people who've been exposed to isolate or to quarantine for up to 2 weeks for 14 days. Does that clear it?
Next question, we go to Lisa Houston, News 1130.
Hi there.
Sorry, Lisa, are you there? I believe you're on hold, Lisa, so we're going to go to Prabjot Kalon, Omni TV.
Yes, thank you so much for taking my question. Yes, Dr. Henry, as we are convincing everyone to take a vaccine, and I know Fraser has set up the kiosk booth today at the Walmart, but we see not really good response comparatively what we are getting the response from the Sikh temple. Yesterday, in few hours, they registered more than 400 people for next clinic. So why we are not increasing those type of the clinic where people feel more comfortable to go there, they are not rely on other people to go to get the vaccination. So there is gap. Even the temple authority saying they are willing to help even 3 clinics a week. So why we are not increasing those services if we want to see more vaccination into the community?
You're absolutely right. We need to do all of these things, not one or the other. And I know there's a concerted effort in the city of Surrey, particularly working with Fraser Health to engage with all those different settings for different populations in those communities. And right now, the immunization clinics that we have are set up to be able to very rapidly expand. So it's much more challenging to bring vaccine by itself to different areas. That's why we're right now focusing on people registering and then supporting them to get to one of the mass clinics. But we are also looking at many different ways where we can bring vaccine to people as we have more and more vaccine available. And one of the things that we're waiting for is the Pfizer vaccine still is a very fussy vaccine. It can only stay at room temperature for a very short period of time. But we're learning more about the stability of the vaccine. And the company has provided data to Health Canada that we hope Health Canada is in the process of reviewing that will allow us to keep it thawed in the fridge for up to a month. And that will make it much more flexible for us to be able to do exactly what you're saying, not only register people, but bring vaccine to temples, to gurdwaras, to other community places where people are more comfortable.
Prabjot, do you have a follow-up?
Yes, please. So do you think in coming days we can see more data, how many people got vaccinated in particular communities, especially like in Surrey? What is the ratio of the population above 18 got vaccination and how many people are not showing interest, something like that, the details?
Yes, and these are the data that we've posted already. We're working on, and I was hoping to have ready last week, but an interactive platform on our website where you can look at that by community health service area and LHA in most places, but CHSA in some areas, where you can actually look not only at the COVID rates, the immunization rates, but also looking at it by age and age group, because one of the big factors that we know is that the structure of the population is different in different communities. So, for example, in White Rock, there's a much higher proportion of older people. So the immunization rates are higher in that community because older people have been able to receive their vaccines for a longer period of time. We know in some communities the age is much lower, so there's a lot of younger people, and that's the case in many communities in and around Surrey, that the population that's eligible for vaccine is now going down. So we should start to see those increasing quite dramatically. And I think the really important thing is what you say, to watch the data move over time. So where we've seen really good results in some of the communities where we've paid attention to it, and I know some of them are actually in Surrey, for example, where we've seen immunization rates go up really dramatically in the last few weeks as we've been paying more attention to it, as we've had the data really only since the middle of April. So that's really exciting, and it's a way for every community to look at how they're doing compared to the population in their community. And it's a way for us to look at each other and support each other to go and get immunized and to keep our community safe, to know that we can each do our bit in our community to keep it safe. The one other thing I will say about the data is that in smaller communities, there's a lot of fluctuation. We saw that in places like Summerland, for example, where case rates went up really high, but that's just a small number of people because it's a relatively small community. And when people started paying attention to that, of course, it settled back down again. So there's lots of things in the data that qualify what it actually tells us, but I think these are really great things. And going forward, we will be able to look by community and see how we're doing and know that it makes a difference for each of us to get immunized in our community. Did you want to say something about Surrey in particular?
Just to express my appreciation to many gurdwaras, many mosques, other organizations in Surrey who are supporting the effort there. As you know, by local health area, Surrey is more vaccinated than average, but when you look at different neighborhoods in Surrey, the level of immunization varies. But there has been an enormous effort, and that effort is going to continue to grow. I remind everybody in Surrey, because almost all of Surrey is in a community health service area, is considered a hotspot, that it's 18 and above. You register, and you'll be invited to book very soon after you register. People can go as families, all the adults and families can go. It's critically important that to register, though, because whether you're in Surrey or not, after the weekend, everyone's going to be able to register and book their vaccination. And in most of Surrey, in all the hotspots community in Surrey, you can register and then you're eligible to book right away. So this is the time to register, and I want to thank the huge effort in Surrey across political lines, across community lines, and many diverse communities that people are making to get people immunized. So you can see the progress already, and we have to really keep going. This week in BC, the week that started Monday, where we've booked, I believe, in the neighborhood of 330,000 appointments across British Columbia, and obviously many of those are focused in our hotspot areas. That shows the capacity, and that's going to be a typical week from now on as we build and immunize more and more people. So it's really important right now. It's a real opportunity to get registered today, get registered tomorrow, get registered as soon as possible, and encourage anyone you know to get registered.
Next question, Rob Brown, Dawson Creek Mirror.
Good afternoon. Thanks for taking the call today and the time. Regarding up here, a little bit of a different situation. Obviously, Alberta, 10 kilometers away, and Fort St. John and Fort Nelson being added to the high case areas with Dawson Creek, and then even today, just North Peace, numbers revealing over 1,000 cases, and then South Peace almost 1,000 as well. I was wondering, either from the minister or Dr. Henry, if there's any special consideration being considered for the North as far as travel or stopping transmission or anything related to that, just because of the proximity to Alberta.
Yeah, and we know that it's been something we've been discussing with our colleagues in the North for a long time. We know that there's lots of reasons people travel back and forth, particularly in the North Peace and the Peace region, and it is challenging. We know that a lot of it is work travel. So we have done a concerted effort working with some of the large industrial camps and mines around those areas to immunize workers, and particularly the rotational workers who are coming through to try and reduce those risks. We saw a lot of that prior to Christmas, and there was a lot of outbreaks, a very challenging time. So we've been working with a lot of the businesses in the North to try and reduce the risk, build back up slowly, and that's been effective. It's working. But I also want to say, and we've been targeting a number of the communities for increased vaccine, increased immunization clinics, and we are hearing that there are some people in many communities who are reluctant. You know, Fort St. John, there is challenges in people wanting to be immunized. So I would say everybody needs to reach out and talk to their neighbors, talk to their friends. You can see the issues that we're dealing with, and we all need to be immunized now. There's vaccine available for everybody. Northern Health is making it available in communities through a variety of different ways, and it right now is really important in those communities too. Yeah.
And just with respect to the piece, I want to express my appreciation to Mayor Ackerman, Mayor Bumstead, and the two large communities and community leaders across the region. If you look at along the Alberta border, a number of weeks ago, we saw relatively low immunization rates, and those are going up. We made a major effort a few weeks ago in Dawson Creek related to transmission in that community, but also as you go further down the border, further south along the border in the Golden Local Health Area, in the Windermere Local Health Area, the Columbia Valley, and obviously in Revelstoke, and we see the effect of that over a period of weeks. So I want to express my appreciation to everyone, including my MLA colleagues, Mike Bernier, Dan Davies, who have been working on this effort and convincing people both to get immunized. And we've seen a very positive response, I think, in the last week in Fort St. John. We've already seen a positive response in Dawson Creek, and we hope that that continues. It's important for people in those communities to get immunized, and in hotspot communities across BC to do so. And we see when it happens. We've seen it in the Columbia Valley, we've seen it in Revelstoke, we're seeing it in Golden, we're seeing it in Dawson Creek, we'll see it in Fort St. John. Get registered and get immunized.
Rob, do you have a follow-up?
I do. A couple of specific, or certainly less umbrella incidents up here. One was just over the past weekend, it being Mother's Day. I can think of many people that are going through certainly custody and all kinds of court issues, whether they're custody related or not. But I have a single father who, going into Mother's Day, does the exchange and then proceeds to watch the mother of the children, literally drive to Alberta, go around the Mile roundabout, and head off to, into Spirit River, Rycroft, up to Hines Creek area, which is obviously nowhere near the area. And then the other example in the North Piece, I can think of the Presbytu church gathering where the RCMP put out a release and clearly, to use an old school term, turned dime on Bell Media, who tipped them off. I was just wondering when it relates to, again, attempting to stop transmission, lowering risk, and holding the line, how does either the minister or Public Health and Dr. Henry expected that to, these numbers to go down when either enforcement seems to be letting people know who does tip them off, or in some cases, again, it seems to be a free-for-all as far as travel, regardless of what people think as far as what is safe and what isn't. How do, I guess, what do you say to people that are still continuing to break these things, and then how does it work for the general public when, as again, colleagues like Mike Bernier are doing everything they can, and that, transmission is still out and about, so to speak.
Absolutely, and this is about human behavior, and we've known that from the beginning. There is a certain amount of enforcement that we can do, but it is all about us, and it's about us having that influence on those that our family, our friends, to ensure that they're doing their part too. But we recognize that this virus is transmitted when people travel and when we're close to people, and it can happen very quickly and it can spread very quickly. So that's why it's important across the board to all of us to pay attention to these issues. And yes, it can be very challenging and frustrating when we see small, one or two visible actions like that. But overall, we know that people are doing the right thing, and we need to encourage and support people to be able to do the right thing. And we all know what that is now, and that is staying small, staying local, wearing masks when we're out in public. It also means now that we have ways of protecting both ourselves, our family, and our community, and that's where immunization is so important.
We have time for one more question. For everyone listening, Dr. Henry and Minister Dix will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. Last question goes to Tanya Fletcher, CBC.
Yeah, Dr. Henry, 28 cases of the AstraZeneca-related blood clots have now been reported in Canada, including BC's second case that you just mentioned. All along, you said these instances are extremely rare and it's still safe, but is that number higher than you expected here? And for those who are now considering a second dose of AstraZeneca, can you confirm that most of the VIT cases are after the first dose and not the second?
Yeah, so, once we identify something and we're looking for it, it's very clear that we tend to see more. And in one way, we put out that word across Canada, so it is important that people, if they have the symptoms, that they get assessed and treated, and we've put the word out to clinicians as well. So in some ways, that's a good thing. It's not above what could be expected, what we've seen in other places, and it is an important safety signal, but we also have to put it in the context of what we're seeing in terms of cases and risk of COVID in our communities too, which we know are affecting all ages of people, which we know are more likely to cause hospitalization, severe injury, blood clots, different types of blood clots, but certainly we know especially young people are having severe disease with COVID-19. So the risk-benefit profile changes as cases start to come down and as more people are protected with immunization, and that's something we've seen in the UK, we've seen here as well. But we also know, as you say, that so far it appears the risk is much less with dose 2. If you are going to develop, as I mentioned earlier, that what it seems to be that the vaccine or something related to the vaccine in some people triggers their immune response to develop antibodies to our own platelets. And it's a similar phenomenon that we've seen with some people who receive the medication heparin. It happens actually much more commonly with that medication, heparin, which is used very frequently. But it's a very serious thing because once you have antibodies to your platelets, they clump together, and that can lead to very severe plugging of some of our important blood vessels. So yes, very challenging, very serious. It seems, though, that you're more likely to develop it the first time you're exposed to the vaccine. And we're watching very carefully. It could just be because we haven't given as many second doses. We have seen a few cases, but it really is in the realm of 1 in a million right now, particularly in the UK. We're looking at that data, watching that very carefully. And I will say, if we look at other countries who are using AstraZeneca quite widely, Germany right now is using it, and it really is that risk-benefit on an individual level. So here in Canada, we have the benefit now of having other alternatives for people, and there's no longer that wait that you need to have to receive the Pfizer or Moderna vaccines. So individuals can make that decision whether they want to receive AstraZeneca or the Pfizer Moderna vaccines now. And we want to make sure that we're because we have those choices, that we're not receiving more of the AstraZeneca vaccine than people want to take, because we know globally there's a need for immunization for protection in many other countries as well.
Tanya, do you have a follow-up?
Yes, please. And if we could get an answer to both questions in French, that would be great. Is BC planning any immunization incentives? This is becoming more common in the U.S., where people are being offered things like free sports tickets. Some parts of the north. So what is the province going to do about that to get us to herd immunity?
Yeah, right now, a lot of what we are hearing from people is still that they have questions and they're not sure that it's for them. And really what we are hearing as we move more and more and it's more and more available to people, that acceptance, people are getting their questions answered, and that acceptance is going up. And we are working right now at the community level to help people understand the vaccine, what's available to them, make it accessible so there's no barriers for them being able to get the vaccine. And that is where we're seeing good uptake across the board. So we do need to work with community groups, with leaders in the community, for those communities where vaccine is not as commonly accepted. Right now, we're not considering incentives, but that's something that is always in there. I more think that when we see how much benefit there is and how it can protect not just us, but our families, our loved ones, our people at home, that people do recognize that that's a positive benefit. I think, what did they use it, a positive externality, as they say in the economics world. And that does appeal to many of us. And I know many young people in my life tell me that they are going to be vaccinated also because they want to get their life back. And that is an incentive for all of us. We can see how effective it is in other communities around the world, and some of the data I presented today. When we get enough people protected and we get our transmission down, that's when we can get back to those important things that we want in our life. And we can't underestimate that as an incentive for all of us for getting through this pandemic.
And Tanya, there have been 272,537 doses of AstraZeneca administered in BC. Almost all of them, well over 99%, are first doses. We only received AstraZeneca 60 days ago or 2 months ago or so. And so they're all essentially first doses with a few exceptions. Je voudrais dire en français que, bien entendu, les 2 cas de vide ici en Colombie-Britannique nous concernent, doivent nous concerner tous, je pense, tous et toutes. Cela étant, on a fait 272 000 vaccination avec l'AstraZeneca en Colombie-Britannique. On a 2 cas et ces cas sont sérieux et on prend chaque cas au sérieux dans la province. Mais c'est ce qu'on a voit. L'évidence dans la Grande-Bretagne indique qu'il y a moins d'effets sur la deuxième dose, mais il me semble, Dr. Henry, qu'on va avoir l'opportunité pour une deuxième dose, sans doute, c'est-à-dire probablement pour les gens de faire leur propre choix sur la deuxième dose, mais on va voir. On n'est pas à ce moment, à cela en ce moment, mais on va être là, je pense, bientôt. Je dirais en général que d'être vacciné, c'est un atout en soi, c'est une opportunité en soi. Je pense que 86% des gens de plus de 70 ans ont déjà été vaccinés, plus que 80% des gens ont plus de 60 ans ont déjà été vaccinés. Donc je pense qu'on voit un peu partout dans la province l'intention des gens d'être vaccinés. Il faut continuer à faire notre campagne publique sur cette question et je pense qu'on va avoir des réussites, mais je ne pense pas qu'il faut donner plus aux gens. Je pense que le fait d'être vacciné, c'est déjà beaucoup et j'espère qu'on a vu cela depuis une semaine où on a augmenté le nombre d'inscriptions dans notre système par 600 000 personnes. Il y a beaucoup d'inspiration un peu partout dans la province et je m'en réjouis. Thank you very much. Merci beaucoup. We'll see you on Monday.